Hi everyone, my name is Carlos Arturo Aguilar Arias and I'm a student. Today I'm going to talk about a very important topic for the population in general, and that topic is a disease called type 2 diabetes mellitus. This is the presentation program. Number 1, abstract. Number 2, introduction. Number 3, methodology. Number 4, clinical case. Number 5, discussion. And number 6, conclusions. And the title of the presentation is Importance of the Lifestyle Change in the Patients with the Type 2 Diabetes Mellitus. This title is because in our country we live a worrying situation with respect to obesity and its complications, and how a healthy lifestyle can change the course of the disease. Let's start. Abstract. 62 years old female patient who attend a type 2 diabetes control consultation with 21 years of evolution. Said patient does not have complications from the current disease. There are only laboratory values close to the limit and with an inadequate weight due to insufficient adherence to eating habits, but showing improvement in all its parameters after a modification in its lifestyle. Now, introduction. We can describe type 2 diabetes mellitus as a chronic metabolopathy that is mainly characterized by the presence of the hyperglycemia accompanied by relatively deficiencies in insulin production, which produce a lower response of the tissues in which his hormone acts. It is a serious public health problem and contributes significantly to increased morbidity and mortality in general population worldwide. The disease is usually more frequent in males than in females, and its prevalence increases with age. However, in recent years, it has increased impreviously in young people, an increase that is attributed to low physical activity and thus the presence of obesity. Methodology. In this case, use was mainly made of the AIMS clinical practice guidelines for this realization, since the main objective is that of the control study of type 2 diabetes mellitus, also relying on publications made by the American Association of Clinical Endocrinologists and American College of Endocrinology, which tell us about the quality of life of diabetic patients, encouraging greater preservations of the quadratic by professional as well as self-care of the patients. Science studies carried out by Association of Cardiometric Multimorbidity with mortality have shown a reduction less 60 years of life of diabetic patient due to the risk of cardiovascular disease associated with diabetes and metabolic syndrome. For the diagnosis of the patient, I base mainly of the clinical findings in the anamnesis, having as symptoms of polydipsia, polyuria, and polyphagia, in addition to acanthosis nigricans in skin folds, as well as unexplained weight loss. And now, the clinical case. A 62 years old female patient attend her follow-up visit for type 2 diabetes mellitus with approximately 21 years of evolution, family history of hypertension, tuberculosis, preeclampsia, cancer, HIV, and IIDS, and other family history. Allergies denied. She lives in her parents' house, material walls and tin roof, with 2 rooms, kitchen with a stove and firewood, dirty yard, positive zoonosis, poultry and dog, varied diet, good hygiene habits, 6 semesters of high school, free onion, dedicated to study, believe in religion with current vacation schedule. Denies negative alcoholism, smoking, drugs addictions, and personal history of pathological, surgical, denies traumatic, transfusion, phimicus, and neoplasms, and allergies denied. The physical examination. At the physical examination, we find a female patient of apparent age equal to the chronological age, average consultation, well-conformed, freely chosen attitude, without characteristic patches, good coloration and hydration, conscious and oriented. Vital signs stable, blood pressure 130 for 70 milligrams of mercury, control capillary glycemia 170 milligrams of deciliter, weight 70 kilograms, head normocephalic without sinks or fractures, symmetrical face, isochoric pupils, normoreflexic, hydred oral cavity, cylindrical neck, not painful without jugular plethora, chest of normal shape and volume, rhythmic respiratory movements, ventilated lungs failed, heart sounds of good tone and intensity without aggregated. Breast according to the sex and age. Abdomen soft, depressible, without pain on palpation, without megalithes, peristalsis present. Genitals according to sex and age, without transvaginal losses. Extremities. Well formed, without edema, pulses present, good capillary filling, rose and sensibility preserved, without data of peripheral venous insufficiency, freed without lesions. Vital signs. Blood pressure 130 per 7 milligrams of mercury, 86 beating per minute, the heart ratio 86 beating per minute, respiratory per minute 18 respiratory per minute, and temperature 36 8 centigrade Celsius. Somatometry, weight 70 kilograms, height 156 centimeters, glucose 170 milligrams per deciliter, weight 94 centimeters. Result of pathological test: fasting blood glucose 129 milligrams of deciliters, postprandial blood glucose 150 milligrams per deciliters, glucosylated hemoglobin 6.4%, serum total cholesterol 107 milligrams per deciliter, serum triglycerides 106 milligrams per deciliters, body mass index 28 kilograms per for cubic meters. Findings. The somatometry found abdominal girth greater than established limits, as well as body mass index greater than the control goal by 3 kilograms for cubic meters, suggesting total physical activity and without total adherence to diet on the part of the patient. In the assessment of vital signs, no evidence of heart disease secondary to diabetes or increased blood pressures was found. No dyslipidemias present. Rapid glucose test within normal parameters, glycosylated hemoglobin NERS limit, as well as postprandial glucose within acceptable limits. Therapeutics. The main objective of the therapy is in the glycemic control and weight reduction. Glibenclamine, glibenclamine 5 milligrams oral G every 8 hours for 30 days. Metformin 850 milligrams oral G every 8 hours for the 30 days. Moderate physical activity 30 minutes daily. Visit with the nutritionist. Expect outcome of the treatment plan. It is expected that with the visit to the nutritionist and modification of eating habits, as well as increase in physical activity, the waist size will decrease by at least 10 centimeters and correct body mass index the body mass index, hoping to start with a reduction of at least 2 kilograms for cubic meters to favor a reduction in laboratory results and gradually move away from the limits. The actual outcome: in the first 2 months after her last control visit, the patient has shown a better adherence to diet and physical activity, resulting in a reduction of 11 centimeters in abdominal girth, being 3 centimeters from target measurement, and reducing her body mass index 3 kilograms for cubic meters. The latter entering within the normal parameters. Discussion. The patient in this case is a patient of many years of evolution, and the time due to the living conditions and culture a little varied food. She has been led to develop the most common chronic degenerative disease in Mexico, which is a type 2 diabetes. Unfavorable lifestyle for the health of the patient has generated problems over the years in order to establishing adequate control of her glycemia. However, the most recent consultations have seen a beneficial evolution of the case. Several of the main objectives in the treatment have been achieved. However, the new goals set the objective of being able to take the parameters through by the laboratories increasingly far from the limits that is in the place where the patient is currently located. Conclusion: a healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use can prevent type 2 diabetes mellitus or delay its onset. This is of a vital importance since the main reasons why low-income countries are more affected is due to the lack of education in terms of the quality of life. At present, we live a society reluctant to adopt better eating and health habits, wanting to avoid the situation, so ignoring it will lead to further complications. Until now, it was thought that type 2 diabetes could only be present in adults, but more recently it has been observed in children as a result of little education in nutrition and the limited possibilities of achieving a balanced diet. Well, this is all of my part, and thanks for watching.